On behalf of the House Democratic Caucus, I want to thank you all for being here for our weekly press conference. I guess week 9 of the legislative session has now come to an end, and the issue of the day is still the budget and the inability of the folks in charge, the governor, the speaker, and the pro tem, to come together for a solution to really help solve the state's $1.3 billion budget hole. Now, we've been talking about it for weeks, and for the last several weeks, the governor, the speaker, and our friend in the Office of State Finance, Preston Dorflinger, have sort of cast rocks in our direction, sort of cast aspersions, and are making the false claim that my caucus isn't willing to do the difficult things to offer up real solutions to close this budget gap. Apparently, they haven't been listening for the last several weeks, and so we want to reiterate that we do have solutions that we brought to the table. But apparently, since they haven't listened, there are some lessons that need to be learned. And so not only do I want to offer up our solutions that we've offered to the speaker personally, that I've offered to the governor personally, but I also want to offer up a few lessons that I think need to be learned by the folks in charge. The first thing is this: our solutions involved fixing the problems that got us here in the first place. Fixing the income tax cuts in January that took effect, rolling those income tax cuts back, fixing the gross production tax, indexing it to the price of oil, so that way when our citizens are paying $3.50 a gallon again in the near future, that our state will be able to reap the benefits from that. And taking a look at significant tax credit reform for those areas that are not benefiting the state. We have offered all three of those as a potential solution to this budget shortfall. Unfortunately, the majority has refused to accept those because they know that in order to do that, they'd have to admit that they made a mistake. And that brings me to my 3 lessons. The lessons that we want the majority party and the governor to learn are threefold. So we want them to learn a history lesson, we want them to learn a civics lesson, and we want them to learn a math lesson. First and foremost, the history lesson is this: we are not in this situation just solely because of the price of oil. People must remember that 3 or 4 years ago, when the price of oil was over $100 a barrel, this legislature, this governor, cut public education funding deeper than any other state in the nation. When it was $100 a barrel, they cut funding for vulnerable children, senior citizens, and others in the state of Oklahoma. That's the history of it. When it was $100 a barrel, they did that, and at the same time, they decided to cut $1 billion worth of income taxes and give away the lowest gross production tax of any oil-producing state in the entire country. They did all of those things to bring us to this point. And in the same process, they also offered up $2 billion worth of tax credits and exemptions. History proves that not only did the majority party and the governor support all of those measures, but my caucus, the members who are standing here with me and others, they opposed the fiscally irresponsible tax cuts that took effect this January. They opposed the fiscally irresponsible gross production tax giveaways. They opposed many of the tax credits and exemptions that helped to create this hole. We stood on the right side of history years ago and made the tough votes against the special interest because we knew one day the price of oil would collapse and the citizens of Oklahoma would pay the price. And that's exactly where we are. History shows that we were on the right side and the House Republicans and the governor were on the wrong side. That's the history lesson. The civics lesson, though, is this: the speaker and the governor and the pro tem have offered up their solutions to solving this budget hole. They don't involve looking at history and fixing the problems that got us here: income tax cuts, gross production tax cuts, and tax credits and exemptions. No, the solutions that they offer up are increasing more debt. They believe somehow that you can borrow your way out of debt. They're offering up $400 million worth of bond proposals to simply put a one-time Band-Aid to fix this year's budget and blow a $400 million hole in next year's budget. Well, if that's one of their solutions, civics lesson tells us this: the state constitution says it only takes 51 votes to take out more debt. Second thing is this: the governor offered up in her State of the State address that she thinks that senior citizens who get haircuts on Saturday morning, or that they go to doctor's visits, that maybe they ought to pay a sales tax on those services. That was their solution to help close this gap. Well, the civics lesson tells them this: if they want to get rid of those sales tax exemptions and make senior citizens pay more to see the doctor, or make you pay more to go get a haircut, it only takes 51 votes in the Constitution to get that done. And finally, they offered up a plan in the state Senate, the Republicans did, that said they wanted to get rid of the tax credit for things like the aerospace engineering credit for Boeing. Well, if they want to raise taxes on Boeing and push more jobs out of the state of Oklahoma, the civics lesson tells you this: under the Oklahoma Constitution, it only takes 51 votes to raise taxes on Boeing. There's your civics lesson to the majority party. And now it's time for the math lesson. The Speaker of the House has 71 Republican members in his caucus. 71. Civics lesson tells us if they want to take out more debt, raise taxes on haircuts and doctor's visits, or raise taxes on industries like Boeing in the state of Oklahoma, it only takes 51. And so apparently the Speaker needs to understand that with his 71 members, all he's got to do is get 51 of them to push us further into debt or to raise taxes on middle-class families and on vital business industries. That's all it takes. And so the last check, while our 30 members of the House caucus have offered up real solutions to solve this problem, we refuse to raise taxes on important businesses and refuse to raise taxes on middle-class families in Oklahoma. And so the math lesson is this: Mr. Speaker, don't dare stand up and blame my caucus for not trying to close the budget hole. We've offered solutions. This governor and this speaker have refused to accept them. Instead, if he can't find a way to get 51 of his 71 members to raise taxes on businesses, to raise taxes on haircuts, and to raise taxes on vulnerable people in the state of Oklahoma, that's not our fault. That's a leadership fault for not being able to get 51 votes out of his caucus to support that. And with that, we hope that the majority party will learn the history lesson, the civics lesson, and the math lesson, because if they don't, I'm afraid the people of Oklahoma and those most vulnerable in our state are going to continue to suffer. Since January 1 of this year, public education has taken a $109 million cut, which turned out to about a 7% cut already. Now, we've offered up $51 million worth of rainy day money to help mitigate that, but that cut it in half, not quite in half. So you could assume that public education has already taken a 3.5% budget cut since January, on top of the cuts that they took last year. So if you take 5% cuts more, that's looking at an 8.5% to a 9% budget cut from last year to this coming year. Close to a 10% budget cut is devastating when you consider the fact that already our public schools, like D.D. Kirkland and Putnam City, are having to close and go to a pre-K through second grade situation because they can't afford to keep that school open. 208 teachers in Oklahoma City have already been laid off, and that's just with the 3.5% budget cuts that have taken effect. If you layer on another 5% budget cut to our public schools, what's that going to look like for our kids? We are in a crisis mode, and the Republican majority needs to find a way to fix this gap by rolling back income taxes, adjusting the gross production tax, and getting rid of those credits that don't really make a difference in the state of Oklahoma, so that we can mitigate and hopefully prevent public education from taking an even deeper cut. We'll see what happens. We'll see whether or not the majority party has the fortitude to stand up and roll back some of these irresponsible decisions. If they'll do that, then I think we can hopefully keep those cuts to a responsible level, as responsible as you can be. But I'm afraid that since they won't touch the income tax cuts, they won't touch the gross production tax cuts, and they're looking at trying to pass things that I believe the majority of their members in their caucus won't support, like a gasoline tax increase or a cigarette tax increase. I think the public schools are going to look at some darker times ahead. And I appreciate Nico Gomez of the Oklahoma Healthcare Authority for trying to find a way to bring our federal dollars home to take care of the many of the uninsured in the state. We've said all along, let's not play games with people's health care. We've already paid our tax dollars to Washington. Let's bring those tax dollars home and cover our citizens. Unfortunately, the House Republican majority refuses to just simply bring those dollars home, not to play games with them, just bring them straight home. So what Director Gomez is trying to do is trying to find a plan that would be palatable for everybody. There are some good things and some bad things about it. One of the good things is it finds a way to bring our federal dollars home, so in essence it's some version of Medicaid expansion. And so while we appreciate them trying to do that, some of the ways they go about paying for it may be problematic. There's sort of 4 tiers of payment. One is a cigarette tax increase, which would require 76 votes. I think that's going to be very difficult to get off the House floor. Another thing would be to be pushing pregnant women and children who are currently on Medicaid off of Medicaid and onto the healthcare marketplace, which would require them to pay more in copays and have certain limits placed upon them in what kind of healthcare they could access. And our caucus has some concerns about doing that. We think if you just straight expanded Medicaid and the state picks up the cost, that's a better way to do it instead of making pregnant women and children pick up that cost. And then a couple of other ways are more of a direct hit towards hospitals in rural Oklahoma as well as insurance providers. One would be to increase a fee on hospitals all across the state as a way to try to bring our federal dollars home. Many of our hospitals in rural Oklahoma are already teetering on the verge of bankruptcy, and some of them are afraid that if you increase more fees to bring those dollars home, when many of those Medicaid dollars would be spent in the metropolitan areas, that a lot of our rural hospitals may have fees increased on them to simply offset the costs that urban areas pay, which may push them closer to the brink of bankruptcy. And then the fourth area is an increase in fees on insurance plans, which we think at the end of the day would be passed down to our citizens. And so while we appreciate Nico trying to get it done, and we're willing to work with him, we're not opposed to the plan. We have concerns about some of the funding mechanisms. We think at the end of the day, we just need to step up and do what's right, do what other states have done, like John Kasich did in Ohio, and just bring those federal dollars home and not make poor and vulnerable people in Oklahoma pay the price for it. There's not a vote necessary on the House floor to bring our federal dollars home. If the governor would stand up and do the right thing, she could direct Nico Gomez with the stroke of a pen to accept dollars, bring them into the Health Care Authority, and expand Medicaid today, which absolutely could mitigate those cuts. But because the House Republicans and the Senate Republicans want to play games with that, they refuse to do that because politics apparently is more important than people's lives and their health care. Because of that, it's going to be very difficult to find any quick solution to get there. I mean, to think about it, they would much rather raise taxes, cigarette taxes on people or gasoline taxes on people than just bring the federal dollars home. The people of Oklahoma, it should be crystal clear to everybody. The people of Oklahoma have already paid for these health care dollars. We have sent our federal tax dollars to Washington, and the governor has refused to bring our tax dollars home. So what the governor is asking is, well, give me more of your tax dollars in the form of a tax increase on gasoline or a tax increase on cigarettes. And we're supposed to trust her that she can do what's right with those tax dollars when she's already shown us she can't do what's right with our tax dollars that we've sent to Washington and said just bring them home. So our caucus is in a position of saying, Governor, if you want to get serious about fixing the health care problems in Oklahoma, well, then show you're serious and bring our dollars home. Don't ask us to pay more. We've already paid plenty. Oklahomans have already paid plenty. Bring those dollars home. Let's cover our people today, and then we can talk about other ways to raise revenue in the state. But as of this moment, there's not the political will in the majority party to do it. Our caucus supports it, but they don't. The argument is made by the Republicans in charge that the state can't afford to spend $60 or $70 million a year to expand Medicaid, but somehow we could afford a $160 million tax cut in January. Right. It's fiscally irresponsible. And I'll be honest with you, not only can the state afford to do it, the state cannot afford not to. We've got rural hospitals that have already closed in Sayre. The one in Frederick is going to an outpatient facility only. There are hospitals around the state that are looking at no longer being able to have to be able to deliver babies because of this. If we do nothing, if we don't expand Medicaid under the premise that we can't afford the $60 or $70 million a year to expand it, then what's going to happen is rural health care in Oklahoma will shut down as we know it, and that means not only bad things for the people who live in rural Oklahoma, but we also must understand it's horrible for the business community. There are a lot of businesses in the state of Oklahoma who, when they go into rural Oklahoma to do sometimes dangerous things, whether it's the oil field work or construction work, by law, their operations are supposed to be within so many miles of an emergency room. And if those rural hospitals close down, that means not only will the people in those communities not have access to health care, but that also means they'll have fewer jobs being created in rural Oklahoma because those industries will not be allowed legally to do work in those counties. It has far-reaching effects. We cannot afford to continue doing what the governor has got us doing.